Right now, if you scroll through your podcast feed or watch a high-production documentary, you will see classic psychedelics framed as the ultimate solution to the global mental health crisis. Poland's reporting catalyzed a shift in how the media portrays these drugs. Documentaries and podcasts now frequently emphasize rapid, life-changing results, which has hyperinflated public expectations regarding how easy and effective these treatments actually are. But these are highly volatile, context-dependent compounds. Treating them as simple, one-size-fits-all pharmacological solutions ignores the deep clinical complexities required to use them safely. To understand why this hyper-optimistic bubble is so risky today, we have to look back at the last time society believed these exact same molecules were going to save the world. The psychopharmacological era began in 1943 with the discovery of LSD. By the 1950s, these drugs were used in thousands of clinical sessions, backed by serious medical institutions. This wasn't a fringe experiment. Between 1950 and the mid-1960s, scientists published over 1,000 peer-reviewed papers documenting the treatment of over 40,000 patients. Early trials recorded improvement rates of 79% for depressive symptoms. Researchers also saw significant promise in treating chronic alcoholism, obsessive neuroses, and terminal cancer pain. Long before they were associated with cultural revolutions, classic psychedelics were scientifically validated tools on the verge of integrating into mainstream Western psychiatry. That clinical trajectory collapsed in the late 1960s. Research sessions leaked out of the laboratory, and the compounds became the primary sacrament of the anti-establishment counterculture. Mainstream media rapidly inverted its narrative. Reporters abandoned stories of clinical breakthroughs and began sensationalizing reports of acid casualties and out-of-control psychotic episodes. This moral panic led to the 1970 Controlled Substances Act. The government classified these compounds as Schedule I, legally defining them as having no medical value, which effectively froze scientific research for decades. This crackdown effectively prioritized political control over clinical potential. Research halted as the substances were codified as dangerous, regardless of the thousands of successful patient outcomes already on record. Following a decades-long hiatus, modern trials resumed in the 2000s. The data shows a mean effect size of 1.21, a magnitude nearly 4 times higher than the typical results found in trials for standard antidepressants. This chart compares how these treatments work. Standard antidepressants operate as a flat, continuous line of daily symptom management. Classic psychedelics differ by acting as intense episodic agonists at the brain's serotonin 5-HT2A receptors, represented by this single spike. This spike temporarily disrupts the default mode network, the brain's system for rigid, self-referential thought. Breaking this pattern creates a window of neuroplasticity that allows patients to restructure core cognitive processes. These represent 2 different clinical models. Traditional psychiatry is palliative, designed to manage symptoms daily. Psychedelic therapy is catalytic, relying on discrete sessions to disrupt pathological patterns. But that intensity carries risks. Sessions can cause acute cardiovascular spikes and severe transient anxiety. Without proper screening, a small percentage of vulnerable patients may experience worsening depression or suicidal behavior. These compounds are safe only when nested within an extensive framework of professional psychotherapy. The therapy provides the essential scaffolding that protects the patient during this highly vulnerable state. Today, those clinical results have triggered a massive influx of venture capital. Investors are rushing in, aiming to patent and monopolize the psychedelic space. This influx of capital highlights a structural conflict. The current healthcare system is built for cheap, scalable chemical products, and this commercial model often strips away the expensive, multi-hour psychotherapy sessions that actually make the treatment safe. By removing clinical care to maximize profit margins, companies risk exposing patients to immense, unsupported psychological trauma. The current hype bubble often blinds the public to the grueling psychological work these treatments demand, replacing the reality of therapy with the illusion of a quick chemical fix. There is a clear parallel between the naive optimism of the 1960s and the hyper-optimized corporate wellness culture of the 2020s. The scientific truth is that classic psychedelics are highly context-dependent catalysts. They are not independent cures. If these treatments reach the public without the rigorous therapy required to manage them, the potential for patient harm could trigger a regulatory backlash that mirrors the 1970s crash. Prioritizing profit over clinical safety risks losing a model that offers a genuine alternative to chronic daily symptom management. We cannot afford another 50-year hiatus.